serie. Le vamos a pedir a Hans-Peter Hartung, presidente de la Charcot Foundation, que nos haga, por favor, lo mismo, un homenaje a nuestro querido GIANCARLO COMI, que también se fue a conquistar las estrellas. Please, Peter.
Thank you, Gloria. Dear friends and colleagues, last year, shortly after the European Charcot Foundation meeting in Baveno finished, Professor GIANCARLO COMI, its long-standing president, died. He had suffered a catastrophic stroke just hours before the meeting was to start. I just want to briefly say he was 77 when he died, close to Baveno. He was born, raised, and lived in a small town near Bergamo in northern Italy. He did his neurology residency and specialization, also in clinical neurophysiology, under the leadership of Professor Nicolas Canal, who was the first chairman of neurology at San Raffaele Hospital of Università Vita Salute. The list of his achievements, the position he held in recognition of his amazing professional work are listed here. In his later years, he was an honorary professor of the Università Vita Salute at San Raffaele in Milano, the scientific director of the Gallerate MS Center and the MS Center at Casa di Cura Igea in Milano, and importantly for many, many years, the chairman, following Nicolas Canal, of the Department of Neurology at San Raffaele, which really became one of the leading centers of neurology in the world, and of course with a particular focus, but not restricted to multiple sclerosis. His work was recognized, appreciated in Europe. He became president of the European Society of Neurology. Of course, before he was the president of the Italian Society of Neurology and the Italian Society of Clinical Neurophysiology. Until his death, he continued to be the vice chair of the Progressive MS Alliance. He received the 2015 Charcot Award for MS research from MSIF, and he was an honorary member of MEXCTRIMS. And as a sideline, he was interested in many things in life, and one particular area was food and culinary experiences. And in his early career, he wrote some critical reports for the Italian version of the Guide Michelin. So his main scientific areas of interest are listed here: clinical neurophysiology, neuroepidemiology, and multiple sclerosis, particularly treatment of inflammatory peripheral nerve system and CNS disorders. And he started out in the peripheral nerve in studying neuropathies and neuromuscular disorders. As someone very committed to exploration of novel treatments for patients afflicted with neuropathies or later on predominantly MS and related disorders. He was the principal investigator on numerous phase 2 and 3 trials. And his broad, intensive scientific work was reflected in him being author or co-author of more than 1,000 PubMed listed papers. And I shown on the right-hand side one of many great papers describing the results of clinical trials, and this was the first trial to explore the potential therapeutic utility of a disease-modifying therapy to delay the conversion from what at the time was called clinically isolated syndrome to clinically definite MS, and many more trials along these lines followed. And the bottom right, I refer to one of his last papers that appeared in Nature Reviews Neurology on assessing disease progression and treatment response in progressive MS. Progressive MS was one of his major areas of work in the past decade or so. But there was a man with interests beyond medicine, neurology, multiple sclerosis. He had a very broad, comprehensive interest in all things of man, interests, culture, art, history. It's very important to emphasize his tireless commitment to people affected with multiple sclerosis. He was known to be a grandiose networker, fostering collaborations both at regional, national, and international levels, and he promoted the careers of young colleagues. He established close and friendly relationships with the TRIMS around the world, in particular with MEXCTRIMS and LUCTRIMS. He was very fond of the interactions with the Latin American MS world. So, an eminent clinical scientist, an excellent physician, a wonderful colleague, a real mensch, and dear friend has gone. And you could refer to him as a Renaissance man of the 20th and 21st century, and Italians would call him an uomo universale. May he rest in peace.